Hello and welcome to the Going Viral podcast. I'm Matthew Zinder, a certified registered nurse anesthetist. I'm an advanced practice nurse that specializes in the practice of anesthesia. The scope of this podcast will explore health and wellness from the broad to the specific. My aim is to educate while offering a unique perspective. Thank you for joining me today, and let's get right to the show. So thank you for joining me for the first full episode of the Going Viral podcast. I appreciate you joining me again. And today I think that we have a very interesting topic to discuss, and that is decontamination after a shift at a hospital where healthcare providers are taking care of COVID-19 patients. I have a discussion with a very good friend of mine who happens to be a hazardous materials expert. His name is Ray Pearson. And Ray has been on a hazmat response team, and he's been a member and a team leader for 15 years. And he's also a manager of what's called a BSL-3 Research and Development Lab, and he's done that for 10 years. BSL stands for Biosafety Level. He works for a defense contractor, and he's done so also for many years. He is probably one of the smartest people I know, and he knows all about this subject, and he gives us some insights into how to decontaminate after leaving a shift at the hospital. I hope you can gain some insights from this interview. Even if you're listening and you may not be a healthcare provider per se, you can still gain some information on how to keep yourself and your family safe by cleaning from being out and about, even at the grocery store. I also plan on uploading a separate episode that is somewhat of a summary of just the decontamination procedures, because we do go into some other topics as well. So hopefully I'll be able to upload that in the coming days. But in the meantime, I hope you can learn from this episode. So again, here is my interview with hazardous materials expert Ray Pearson. All right, so Ray, thanks very much for joining me on this podcast. I wanted to bring you into this because we've known each other for a very long time, and I know fairly well what you do for a living. And one of those things is being a hazardous materials expert as part of your job description for the defense contractor that you work for. Can you just tell me a little bit more about what you do and kind of your background, and then we can kind of get into a little bit of why we're having a discussion?
Sure. Start with my background and we'll move forward. For 15 years, I worked for a federal agency, and I was a hazmat first responder. Didn't get intentionally into the biological hazards response business, but the events of 2001, we got a baptism by fire, and all of us learned how the proper ways of handling dangerous biological material. After that, I was hired by a defense contractor to come down and manage a research and development laboratory that is a biosafety level 3. That's a classification as to how hazardous an organism we can work in it. It goes from 1 to 5, 5 being like Ebola and smallpox, 3 being in the middle, where you can do research on different types of organisms that travel in aerosol form, which was our primary interest for this laboratory. To run that laboratory, we needed to have the operations worked out such that you could enter and exit safely without bringing any contamination in or out of that lab. And most of my experience came from developing kind of the decon plans for the laboratory and the personnel as they were passing in and out. That would be relevant to the current COVID-19 situation.
Now, when you talk about your earlier experiences, obviously, for those who don't know, one of the earliest stories you ever told me was the fact that you were a worker at Ground Zero after 9/11. And that would be a good comparison to make when discussing this whole pandemic experience that everyone is experiencing. What would your perspective be right now of what we're all going through, and then a little bit comparison of what you went through at 9/11?
9/11 and what we're currently going through, I call kind of crystallization events, to where the entire world has crystallized on a single event. 9/11 came along a lot faster and hit a lot harder immediately because it just happened in hours. The current pandemic kind of slow rolled out, starting around the holidays and kind of hitting the point where it was all anybody was talking about in the last 3 months. But the lasting impact after this, after things go back to normal, it won't be the normal we had before a pandemic. It'll be the post-pandemic normal, just like we had a post-9/11 normal. So yeah, in my head and heart, it's another crystallization event that I guess some of the people that were old enough to remember what the world was like before 9/11 and then what happened to it after 9/11 are going to have to get used to a shift. All the people that were too young to remember that, this will be the first time for them.
Now, with your experience and everything you have seen between that and what you're going through right now, or what everyone's going through right now, what is your general perspective on this whole idea of pandemic and the level of contagion and everything that you've read, whether it's misconception or what the CDC or WHO is saying? What is your general impression on how one should act during this experience?
A couple of different competing emotions here. One is because I have been familiar with how epidemiological studies work, that most of the data that we have for any of the pandemics in the past or any other sort of biological event, MERS, SARS, the data really didn't get finalized where we could make any real conclusions on it until like years after the event had occurred. Right now, we're right in the middle of it. So a lot of the data we're hearing is all conflicting because everything right now would be kind of seat of the pants information. And everybody kind of has an open mic right now. It's not being funneled through any one agency. Anyone that has an opinion can tweet it or pot it or whatever, get it out there. And so there's a lot of, I guess the fog of war would be a good way of describing it. Someday in the future, we'll have probably a fairly good understanding of where this thing started, how it got around, and what the true mortality infections and its level of infection are. But right now, there's just conflicting data. I wouldn't try to say I could see an individual tree through the forest of confusion out there.
There's a lot of unknown right now. And that's probably where some of the anxiety is coming from, or a lot of it. But then the other question is, how does one prevent themselves from catching this virus? Which kind of leads us into the other point of us discussing this, and that is, I really have a lot of colleagues, a lot of friends that are actually still working, and they are working what is now being called the front lines of the hospitals that have the coronavirus in them, and they're taking care of patients that have been infected with the coronavirus. So what I would love to get some information on, and this is for them, is how to protect themselves. Now, there's this national shortage of personal protective equipment. There is some conflict going on within the hospitals as to when and how, or even if you can use the proper personal protective equipment, meaning the N95 masks, respirators, PAPRs, all the different types of equipment. Let's start with that. Obviously, in the news it says N95 mask, that's appropriate. When should you wear it? When you should not wear it? Things like that. And then we can kind of get into post-shift and what they should do then. But should people be wearing this personal protective equipment just to enter the facility? Should they only be wearing it in contact with a known person? Any insights there?
All right. This is where certain things are going to get kind of conflicty. As a former hazmat worker, if there was a area where there was an aerosol nasty, whether it be a type of dust or a germ, before I could enter that zone, I would have to be wearing the appropriate level of protection. For an aerosol transmitted virus that's capable of spreading person to person, that would require one of two things. I would need a full Tyvek suit, I would need gloves, booties, and either a full face respirator or an SCBA. I would have my hood up, I would have my gloves duct taped to my suit, and I would have a full decon team to support my entrance and exit from that zone. That is what I would be, that is what any hazmat worker would doing. When we had my lab in operation with basically benign aerosol organisms that we were working on in a contained chamber, we wore that level of PPE going in and out of my lab.
So what would you say on this level, like what we're dealing with as far as COVID, like how, like in a perfect world, if everybody had everything that they needed, what level?
If the world everybody had what they needed, we'd be following probably those protocols, because you always want to, like the material that worked in my lab was only BSL 2, but we designed the lab to be BSL 3, because from a safety standpoint, if you know your organism is level 2 dangerous, you design all your safety and PPE to be level 3. So when it comes down to healthcare, this is where I say be locally smart, educate yourself with what you're up against, educate yourself with what you believe you would need to protect yourself from something like this. And let's see, it travels by air in little droplets of moisture coming out of people's mouths and noses when they cough and sneeze. What do you think you would need to protect yourself from something like that?
Right. I mean, what are your thoughts on these people that are forced to make their own personal protective equipment? What worries me is that there's been no inspection of those items. There's been, we don't really know if they're truly safe or preventing the virus from getting in. And, that may be, I would hope that it doesn't give them a false sense of safety when it really shouldn't be.
It comes to, if I didn't have any gear and I had to run into my house that was on fire to get somebody out of it, I would take a wet t-shirt, throw it over my face and run in. Is that adequate protection for running into a burning house? Absolutely not. But if I don't have anything better, is it better than nothing? Hell yes.
Right. So you do follow that kind of, that idea of better than nothing. And unfortunately, I think a lot of healthcare providers are forced to make that decision where things are just not available right now. This is so unprecedented, people don't know what to do. So it is good that better than nothing is out there. But in a perfect world, it would be best to have the N95 mask that you only use once, and the PAPR, or, for those types of things. And for some facilities, they are available. I hear that Hopkins is well equipped, but there are other facilities that just aren't. And they are starting to allow people to bring their own in if they have it.
You got to do what's best for yourself and your family. If you have, you do what you can.
This would lead us into, let's try to inform people, even if they, have a difficult situation with the available equipment that they have, whether they're bringing it in from home or whether it's being provided to them at the facility. Let's give them some insight on, just in case they may not know or they need some reinforcement. How can it get on you? How can it stay on you alive? And how can it infect you?
I mean, there's a lot of fog around how all that stuff works right now, because we really just met this organism a little while ago. But if you look at it from an aerosol and a fomite type of standpoint, it's gonna have an affinity for, hair, which is an excellent filter, is where you're gonna see it build up on. When I was working with all of the biological material in the past, most of us had very thinly cropped hair, no beards, and liked it that way because it made decon really easy and there was no place for anything to hide. Unless you're wearing something to protect your eyes are, especially when you're talking about coughs and aerosol droplets, your eyes are probably like the largest target. And it's not like you can walk around with them closed.
Right, exactly. So that's a good lesson. So again, dealing with what is available at these hospital facilities. So number one, it's going to be the paper N95 masks. So let's say, okay, it is a general rule probably that you not have facial hair. For the guys that have beards, they're going to have to shave them off if the N95 is the only way, because the virus could get around the seal.
Your beard is also going to collect them.
Right, good point. So the beard would also possibly collect it.
You're wearing filter material on your face.
Right. So another thing that's a good consideration is the fact that the beard could actually collect it, and then it would also affect the seal around the N95 mask, because obviously you want it completely adhered to the skin.
Yep.
Okay, so then also another thing that we have to think about is what kind of eye protection. So if the eyes are going to be a great conduit for infection, we're obviously going to not just look for safety glasses that have gaps all the way around. We're going to look for some sort of eye protection that is sealed all the way around. Is that correct?
Yes, like a goggles. Medical equivalent or the biological equivalent of like ski goggles. I know in my lab we actually had a set of, actually they were sold as tactical goggles, but they were sealed eyewear that had ballistic glass on them, so you couldn't break it, they wouldn't shatter, and your eyes were safely sealed behind a little gasket. They wrapped around your head very much like a ski goggle, so you had good peripheral vision. You weren't going to trip over things.
So that's the mask. And obviously, if you have a non-disposable respirator type of protection, that would be ideal or better. Obviously, the full face mask respirator is ideal. Speaking from a level playing field, or from low to high protection. Paper N95 mask, then the half reusable respirator, then to the full face mask respirator. Obviously, we want to see if any of that is available. Oh, of course, then the PAPR as well, which is the full body hazardous material protection.
PAPR positive pressure. It pressurizes the mask, so if anything leaks, it will leak out instead of in.
Okay. And I know that there are some facilities that do have a small handful of those. I do know a provider who is on an airway team who has the ability to use one of those, which is obviously a good thing. But they're few and far between. I do know another provider who asked for some companies to purchase, a team of her colleagues and herself. They want to purchase their own, and that was actually a list that you had provided me. We could actually put that in the show notes as well. From there, let's say we've got the N95 or a half face mask, respirator, or and goggles. What then? Gloves, obviously. Shoe coverings, obviously. Hair covering.
Short of if you can't get your hands on a Tyvek suit, which would cover you basically head to toe. Any barrier that you can put between you and potential infection, because if you were in an infected environment, and I can recount a story to where I was in a place where I wasn't supposed to meet any bad biological material, and there was a pump failure, and me and all my friends that were in this area got the full-on decon shower, complete with the mops and the brooms and stuff like that, to make sure that we were squeaky clean at the end of it.
And that was an unexpected exposure.
That was an unexpected exposure, but basically any piece of clothing that was being worn was completely written off at that point in time, including shoes.
So I'm not sure if Tyvek suits are available. Everyone would be in scrubs. The scrubs would probably have been provided by the hospital and washed before putting them on at the beginning of a shift. Obviously, the thought process is protection from head to toe. When going in and dealing with a patient who may be infected. Now, my colleagues are anesthesia providers. They're going to be dealing with airways and airway emergencies, and they're going to be right up there at the end of the barrel of the gun. And
which is where the most likely to encounter the aerosol version of this, from what I've been reading.
Right. So this is where they need to think most, or these are the providers that most need to think about how they are protecting themselves, and with what available. So the idea behind the whole thing would be start with your respiratory system and any exposure, meaning what kind of mask can you use. Then you want to go to eye protection. Then you want to think about your hair and covering it as much as you can, because that is also a conduit. Then you go from your head down to your toes, whether it be Tyvek suit, scrubs, gowns, gloves, and the booties that go over shoes or any type of covering that way. So from priority, it would be from respiratory to head, then down to hands and feet.
You can't get goggles. I know that there's a lot of face shields that if somebody's going to cough in your face or anything like that, at least you have a physical barrier. It's like a windshield in front of you. You're still breathing the same air, but the projection of any droplets or fomites from that person and in close proximity would again be limited.
So that's a good point. So I have seen a lot of people wearing those face shields, at least in pictures, from New York City and things like that. And the thought process behind that would be if you were to walk through a cloud of aerosolized virus or a person coughed in your face, the thought process is that virus hits the face shield and doesn't get into your airway. Do you think that, because again, it lives on surfaces, so it would be living on that face shield as opposed to getting into your airway, but
again, less than stellar, but better than nothing.
We have protected ourselves. We have, to the best of our ability. Hopefully, we are not in a facility that has either not provided us with the proper personal protective equipment, or we're in a facility where we are forced to reuse these masks, because we're also hearing about that. We've gotten through our shift, okay? Let's say we've gotten through our shift, depending on whatever personal protective equipment we had. Hopefully we had the proper safety and prevention to get out of the facility at the end of our shift without having ingested the virus. However, we are now probably covered with it, right? So let's get into that whole concept of decon. How do we decontaminate ourselves at the end of a shift in order to not bring it home to our families or even to the physical structure of our home?
Or your car.
Or your car. Well, that might be inevitable. You might just have to learn to clean it really well each and every time you get into it after a shift.
Okay, well again, let's start with if you were working with a material as dangerous as COVID-19 in a lab environment, you would have a full-on decon line where you came in and you were sprayed down with bleachy water, then somebody scrubbed you down, and then they would help you remove your Tyvek and your mask and your gloves and everything like that, moving forward through usually a 3 or 4 step process to where at the end you're essentially the inside layers are, which you walked in clean, are now clean, and they haven't touched any of the outside layers. That is the way you would do it in a professional environment where you're dealing with pathogens all the time, like my research and development lab, or any kind of federal leveled hazmat site where there's biologics. That would be what the process would be.
So you're talking about in an ideal setting, they would leave the facility and basically walk through a decontamination process before they even get to their cars. That's in a perfect world, and I can tell you that exists nowhere. So
this whole thing can be adapted for what a person could do in a parking lot decon. What you would do is, again, you want to be constantly moving from dirty to clean. Everything that's on the outside of you that's been exposed to the world assume it's dirty. And now what you want to do is start cleaning it and removing it away from you. So at the end, you end up with just you that are clean, and everything that might have gotten dirty in a bag that's not near you at this point in time. But we had some like garden sprayers that had bleachy water. If you don't have a garden sprayer, any sort of little spray bottle will work. And first thing we would do is we'd come out and we'd spray down our hands and put on second gloves. So we now know that our hands are wearing fresh gloves and they're covered with bleach. So we assume that our hands can now touch things that will not get infected and that they're clean. And then we would start going through a process to where we'd be removing layers and putting it in bags that would be to be deconned later. So you're not going to throw all your clothes out. You want to wash your clothes. Go heavy on the bleach or some sort of sanitizing agent when you wash your clothes at this point in time. And you go through that process to where at the end, you'd have, hopefully in this decon kit, you'd have a bag full of clean clothes. When you were done taking off all your old stuff that's dirty, the last thing you would do is remove your mask, wipe that all down, and take a step hopefully to the other side of your car with a bag that had all of your new clean clothes, and you would pop those clothes on, and then you could get in your car and go. There's a lot more to it and a lot more steps, and you kind of want to follow them in the way that I described, such that you're always going one layer at a time, leaving your mask and over your face, because assume that anything that you are shaking off your clothes or anything like that, you might be re-aerosolizing something. So you want to have that mask on the whole time.
Okay, keep the mask on the whole time. That's a good point, because a lot of people, I can tell you that this is something that we've never had to think about. So it's very difficult to come up with a procedure. And I can tell you that just from my own personal experience from leaving a shift at the hospital, I would venture a guess, and this is a guess, but I would venture a guess to say that either people are shedding everything that they wore in their shift or during their shift in a locker room, which is probably a pretty messy area right now, or they're just wearing it home. And they're getting home and in like a garage or a separate room, that's when they're shedding everything off and jumping into the shower. So for those people who may not feel comfortable doing this in a garage of a parking lot, because again, a lot of these people are working in urban areas, so there's no way they're going to be able to do it in the parking lot of a downtown Baltimore hospital, especially, well, I won't name names, but there are certain places that they just won't be able to do that safely. So they're going to need to either change clothes in a locker room, go to their car and go home, or go to their car and go home. So for those people that are stuck doing it that way, that aren't in that perfect situation or ideal situation, I should say, what would you recommend to them?
The kit that I described, you could probably improvise it into like a gym bag or something like that. And as long as you could find some room, some place where you could go to do it, maybe like Superman in the phone booth, but there's got to be some place. Even the stall in the men's room might be better than if you're going to get mugged out in the parking lot or something like that. You can get pretty creative and stuff like this. But it would be a real shame to get through your entire shift without infecting yourself. Then on the way home, scratch your nose, and end up with it there. Or hell, when your wife or your kid come and say daddy or mommy when you get home, and they rub up against your beard or your hair and something falls off onto them. It just seems like in my experience of how you clean yourself coming out of a dangerous site, every time I hear about what healthcare providers do, it just strikes me that we're almost like not in the same world.
Well, we're not. I mean, no healthcare provider that I know, and me included, I've been in healthcare for 25 years, and I was trained in EMS in hazardous materials. I've never had to even think twice about decon. I've never had to think about it in my whole career. And I can tell you that it's just not on our radar. It's, I said in the intro or introductory episode of this podcast, we haven't had to think about putting our lives on the lines to do our job. That's police officers, firefighters, military personnel. Unless you're a military healthcare provider, we don't think about putting our lives on the line. We're in it to save lives and to make people well, but we've never had to think about our own lives to do the job. Now, granted, there's the active shooter situation in our society now, but really, in general, we don't worry about our own lives when we walk into a hospital to do our jobs. But now we have to think about that. And I can tell you that decontamination is also not on the radar for a very large percentage of our population. So that's why this information is so important, because I guarantee you there's a bunch of providers that are getting off in their shift. They're going home, and they're probably shedding somewhere in the house, and they're doing, they're trying to be, vigilant and shedding and throwing it right in the washing machine and jumping in the shower. But are they doing it properly? And probably not. So the recommendation is see if you can do some level of decontamination at the hospital in as safe of a room as you can possibly think of. Maybe pack in that gym bag a bag of Clorox wipes or something equivalent and wipe down all the doorknobs and the surfaces in that room that you're in, and bring up a hefty bag or a trash bag to put all of those things that you're shedding off into, and then put on the clean clothing. Obviously, taking a shower there if you can would be ideal as well, but it's not always practical either, depending on what type of facilities your hospital offers you. But for people who don't have that ability and they do just have to leave and get in their car and go home, what can we tell them? And we can start with, what do you do with the car?
Well, if you have to get in the car, then you're going to have to clean the car down, wipe it down, spray it down.
And that would be every time, right?
Every time. If you work in a biosafety lab, it's almost a joke. You never bring your work home with you.
Right. Yeah, that makes a lot of sense.
When working with anything that's even mildly dangerous, it comes down to a couple of things. What's your level of awareness and your level of concern? There are some people that aren't concerned about this at all. If you are a person that is concerned about this and wants to basically protect themselves, then protect yourself like anything else to the best of your ability. Use your head, use your eyes, make an informed decision, and decide how you want to respond.
You have to get in your car and go home. You're shedding as best you can. So from what I'm getting is the recommendation is you have to clean the car every single time this happens. Clorox wipes appropriate, or anything different than that?
Clorox wipes, I tend to like, and you know this, I have my spray bottle of bleach and some paper towels are really good. The spray tends to go everywhere. You don't miss as much, and if you're afraid of the bleach damaging it, you can use isopropyl alcohol, IPA, also in a spray bottle. Okay. And just wipe everything down. Make sure that you don't leave any stones unturned in this case.
Should we try to wear a mask while we're cleaning as well?
I would say yes. Depending on, again, it comes down to what your level of concern is. My gut would say that I would probably wear a mask when I was cleaning if I knew that there was a possibility of something being there. But that's me, not you. Cleaning your car, you're better off than not cleaning it.
Right, definitely. That's for sure. Because if you've worked a whole shift in a hospital and you dealt with, even if you didn't, but if you dealt with known COVID patients, you're pretty well guaranteed to have it on you. Would that be a safe assumption?
That would be the assumption that I would make, because you always want to make the assumption that would give you the highest level of precaution in this case. Assume it's on you and assume you want to get it off of you as soon as possible before you infect yourself or spread it around.
So as far as, so we've gotten home, we cleaned the car. Should they clean the car as soon as they just pull up to their driveway, or is that something you do later after you decon?
Personally, I would, like everything else, I'd kind of back away from it. I would get out of the car, I would clean the car. And then I would get away from the car, and then I would go through and strip all the stuff off of me, leaving at the end everything that I've touched. I've just moved from the dirty state to the clean state, leaving nothing but a bag full of trash that I'm going to throw out or burn at the end of it. But I would do the car while I'm still wearing as much PPE or protection that I have. Because if you went back and cleaned the car afterwards, whatever clothing you wear, you'd have to run the risk of getting it on your clothes your clean clothes. So you'd want to kind of still do it dirty.
That makes a lot of sense. So these are the types of things that we just haven't had to think about. So everything is in order. You want to do things in a certain order to go from most contaminated to least contaminated, correct?
It's that sequence that you're always kind of moving from dirty to clean. And you don't want to have to go back, because if you go back, you have to clean over again.
Okay, so we've gotten out of the car, we cleaned the car. Let's say we have a place in the house, mudroom, garage, basement, walk out, whatever, we have a set place. Do we want to keep that one same place every single time?
Yeah, but so at the end, when you're all done with this, you're going to decon all that stuff again, and you're going to again clean it all up and make it go away. And if it's in one location, you only got one location to clean.
Sure. So we get to that point, we shed everything into a trash bag, I guess, and then get ourselves into a shower. Anything in particular that one should do cleaning themselves in a shower, or is it just regular old soap, water, and shampoo?
Soap, water, and shampoo. I mean, because we know that soap is really, really good at killing viruses and bacteria. It's also good at keeping things from aerosolizing.
What we'll do is get the clothing that we're wearing into a trash bag, and then from that trash bag into the washing machine, get ourselves into the shower, clean ourselves from head to toe, and then normal wash cycle should take care of any type of virus that is on the clothing that we had. Is that correct? And then wipe down all surfaces that we came in contact with between the area where we shed to the laundry room to the shower. Wipe down everything on the way. Is that correct?
If you did where your decon area would be when you got out of your car, make it as close to your car as possible so you're not smegging up your whole house as you're going through it. And you should be, this is in your house now, you should be leaving that area wearing either completely new, clean items or very little of what you had on there. So there's no chance that you're carrying anything with you when you go and then you go right to the shower.
So in summary of decon procedures after a shift at the hospital, taking care of COVID-19 patients, or in a hospital that just has COVID-19 patients, and it doesn't even matter if you took care of one, the ideal situation would be to decon at the hospital in some room that you deem as clean as possible, and bring some cleaner with you if you need to, and change out of everything as best you can to a clean outfit and trash, or put a trash bag all the contaminated garb. Be best to take a shower at the hospital too if possible. If that's not possible, we get into our car, we go home. Keep the mask on as long as you can. In the driveway, clean the car as best you can after exiting the car. Go to your set spot in the house, or shed everything off into a trash bag. And again, do we still have the mask on at this point?
If you can, I would, because you haven't deconned yourself.
So we're to the point now where we've shed everything off. It's in the trash bag. We take that trash bag to the laundry room, dump it in, start washing the clothes, and then get ourselves into a shower. And when the shower is done, we retrace our steps to clean everything that we touched, or...
You leave that decon area near your house or your garage, you should not have anything on you. You need to be thorough enough that you're done.
Okay. And then clean as you leave it, or clean when you're finished the process, as far as the places in your house?
The process of doing the decon, if you did it correctly, all of the contaminated material should be in either a trash bag that you're going to dispose of, like old paper towels and wipes, or your clothing, which you're going to wash.
Okay.
And then double bag the trash. We're not considering it hazmat material, so you can just throw it out at that point in time. You should make sure that before you're leaving your decon area, you're deconned. Because if you're not, what's the point?
Well, there's still the concept of it being in your hair and things like that. I mean, people are going to jump in a shower after that. So it's going to be that step process where you're less decon, but not completely.
Yeah, so I mean, my guess is that your hair is going to be all wet because you just hosed it down with soapy water, or poured soapy water over it to make sure that you're not going to aerosolize anything as you're walking through your house. You're mostly taking the shower to wash any of the residual sanitizer that you have all over your body off at that point in time. But there should be zero concern that you have any COVID-19 particles on you at this point, or you haven't done your decon right. Right.
Okay. All right. Well, that was a great summary and recommendations for what we can do, because I know it's not on everybody's radar, and I know that a lot of people, myself included, just didn't realize how serious it was and how these procedures need to be a step process. And in order to keep everyone, including yourself and your family, safe when you are known to be exposed to it. Is there anything else that you can think of that you might want to add to any of that?
Yeah, I was never doing it by myself.
That's a great point.
I had a partner with me, and her and I would make sure that even if I wasn't helping her or she wasn't helping me, we were making sure we were doing it right and observing at this point. And yes, occasionally lending a hand when you got soap in your eye and you can't figure out where the water bottle is. Yeah, that's where the buddy helps out an awful lot. But you should not be trying to do this alone. You should always have somebody watching your back.
That makes a lot of sense. Hopefully someone either at the hospital or your significant other at home can help you out with making sure that everything is covered. Or, hey, you didn't clean off that doorknob. Go back and do that before you do the next step. Well, that was great. So I know that between the two of us, we'll put together some literature to put in the show notes between what is available online and something that we can put together from your vast knowledge and experience. And then possibly we can revisit this subject if this podcast is listened to by many people in this situation and they have any questions. We can certainly revisit if you have the time.
Sure. Give them a Q&A if that would help.
You know, what we want to prevent is someone getting off of a shift and then going to the grocery store on the way home. You know, they have to think differently. Well, we have to assume it's on us, and we have to take the proper steps to protect ourselves and our families, especially after we go home from a shift like this. So, yep. Well, thank you very much for your time and your expertise. You have helped a lot of people this evening.
Thank you, Matt.
All right. Anything else to sign off?
Everybody be safe.
All right. Well, thanks very much. Thank you for joining me for the second episode of the Going Viral podcast. As I stated in the beginning of the show, I plan on uploading an audio summary of what we discussed, honing in on specifically the decon procedures for a person who got off of their shift at a hospital in a COVID-19 unit or known COVID-19 exposure. Hopefully we'll keep that around 10 minutes. Please also check back for further episodes. I plan on interviewing many experts in different fields, from specifically COVID-19 issues all the way through to stress management topics. So please check back often, and I will keep you updated on episodes as I can upload it. Also, please subscribe and pass this on to anyone that you think could benefit from this information. And thanks again for tuning in. So that'll do it for this episode. I hope to see you at the next one. This is Matthew Zinder and the Going Viral podcast. Please stay safe and stay well.